Let's talk about root canals. You need a root canal. It's a scary thing. Well, not anymore, not at Ponce Dental Studio. Let me tell you why. Root canals have gotten a bad reputation because there was an era in which my colleagues mistreated the patients and really gave this procedure a bad reputation. Well, what happened? Patients would get a cavity. It would not be diagnosed or fixed. The cavity, which is made out of bacteria eating your tooth structure, would enter the nerve. And as the nerve of your tooth started dying, it would create pain, infection. And what would patients do at that point? They would visit their local dentist. And what that dentist typically try to do is remove the nerve. That's what a root canal is. Well, there's one important point. When you have an infection and when your tooth is hot, it does not numb. That's why we utilize antibiotics today, and that's why we gave you pain medicines to calm the infection, to calm the pain, so we can actually anesthetize you and remove the nerve without you feeling it. And that's why root canals got that bad reputation. Now, what do root canals need to do? We remove the nerve that has become infected inside of your tooth. When you do that, your body recognizes the tooth now in its healthy form, and the little wire that was complaining to your brain through the nerves that something is wrong is now removed. The body accepts the tooth as its own, and by us fixing the cavity that's inside the tooth through a filling or a crown, we're able to help you keep that tooth for probably the rest of your life. Now, root canals need to be done correctly, and at Ponce Dental Studio, we feel that the standard of care is using a microscope and, generally speaking, an endodontist, a dentist trained in only doing root canals. And the purpose of that is to make sure that everything is cleaned out very well. Now, there are dentists who are general and family dentists that are very good at this procedure and can utilize a microscope and generally get that same quality of service. But a root canal does not have to be awful. You just need to make sure that we do it appropriately at a time where you can actually achieve anesthesia and that you are not going to feel pain for the procedure. Most of our patients tell us that during their root canals, they were so comfortable that they were dozing off. That is a compliment for root canals. That's a compliment to our practice. And that's how we want you to be treated when you visit us for that procedure.